Hi there, my name's Matt Doig. I'm one of the directors and creators of Welby Innovate. Our strapline is less work, better care. We want to create and build systems that give you, as a clinician or a practice, less work to do, but actually improve the way you care for your patients. And I'm going to give you a very quick demo of the kinds of ways that we can achieve that. By showing you how it works in practice by following a brief patient journey. So imagine you start a patient on a statin. Perhaps in your practice, you need to send a task or set up a recall to arrange those bloods to do in a few months' time. So with our systems, you'd see this pop up. Do you want to arrange the bloods in 12 weeks? And you click yes. Simple as that. In the background then, our systems will do some codes that the system will use to trigger the invite and display that the patient needs those blood tests taking. For this patient that I demoed it on, because they are needed for prime prevention, it's also calculating and coding their target non-HDL. So to invite them, we've got a clinical report that will identify all those patients who need an invite, not just for that blood test, but for other things as well, say their methotrexate monitoring, their DOAC monitoring. The system will pull all of that together into one joined up process. We can send them a link to book only a bloods because we know they don't need, say, blood pressure or other things that need a longer appointment. And the system will generate a preset message and code it and so on. So that sending of that takes about maybe 30 seconds for perhaps 50 patients. It's really quick and easy. If the patient doesn't respond, they'll get a follow-up reminder. There are also prompts for staff. So when they retrieve the record, it gives them wording that they can read out that explains to the patient what they need and why. Let's say a few months later they order their statin and they're still not engaged and they're overdue now, they're monitoring. This would flag up when the staff issue the statin. You would ask them to arrange the monitoring. If they still don't engage, they can't be booked in, then it would basically say undo the month's issue and only give them 2 weeks, i.e. it's not safe to keep prescribing 4 weeks at a time while they're not engaging and not responding to this invite. Once they've had the bloods, the lipids themselves, along with lots of other results, will be auto-reviewed, so there's no kind of work to be done at a clinical level to file so many results. We can file about half of all your results, a bit more than that, including lots of abnormals. I'm just going to show you briefly how, in this scenario, our system would manage that. So a protocol would check the actual non-HDL against that target that was coded, and documenting that in the notes. And if they're not hitting the target, they'll be sent a message like this one. Your statins not reduce your cholesterol as much as we'd like. They get a questionnaire to first check their compliance. And if the compliance is good, are they happy for us to increase their dose? And a good chunk of patients will say yes to that. And so they don't need an appointment. It's a very quick job for a pharmacist or prescriber to make that change. Our template will then display the information that's needed here. You can see what they're currently on, what they've tried previously, and so on. And there's even a button for titrating the statin. That button will work out what are they currently on, what do they need to be put on. It will add that on to repeat and message the patient to tell them that. So what are the outcomes? Well, we think we've generated here less work. So it's one click to arrange the monitoring bloods. The invites are done in bulk. We're trying to avoid lots of kind of individual patient by patient contact. The results are auto-reviewed, no clicks needed there by result, and the medication is titrated without the need for any appointment. But we think we're delivering better care. We're less reliant upon everyone must remember to. We know everyone forgets things. We're human. There are safety nets in place. If the patient doesn't attend, the management of the patient is consistent, and the meds are optimized based on best practice, not based on how, we know that people have different days, different approaches to managing results. This achieves consistency and consistent better outcomes for your patients. This is a small snapshot of the things that we can do, but hopefully gives you an idea. If you'd like to know more, get in touch, book a demo. There are demo videos for each of the modules that give you a lot more information. We'd love to tell you more and talk to you about how we can help your practice. Thanks.